Hi, Dr. Paula Sauer here. This is the second part to my series on what do I do when my knee hurts. And this is the patellar-femoral joint that we're still talking about. My other video shows you how to release all the soft tissue around. So this is the follow-up video to that. Now that we've released everything, what do? Well, we have to strengthen everything. So we're gonna start with the gluteal isometric series. I have that as a separate video, but I want you to do this because it's that important. So we're gonna go through that first. And then we're gonna do some functional movements, some squats, double leg squats and single leg squats with a TheraBand so you can watch the tracking of your knee and where it's moving. Because really ultimately, the control of what's happening at your knee is coming from much higher up into your gluteal region. So that is the emphasis of this video today. Okay, so you'll need a TheraBand for this exercise sequence. You're gonna take the TheraBand and tie it around your thighs. And for those of you who do this video frequently, if you want more of a challenge, or if you're stronger in general, you would double tie this TheraBand, meaning you would take the middle part of the TheraBand on the front of your thighs, cross it underneath, pull it tight, and then tie a bow here. This gives you a lot of resistance. For everybody else, you take the TheraBand, place it under your thighs, keep your legs together, tie it tight, okay? You want resistance here. And tie a bow. You need a heavy TheraBand for this. So they come in dark purple, they'll come in black, or they'll come in light gray, are typically the ones that I see. If you don't have that and you have several of the lighter TheraBands, you're gonna stack them all on top of each other and then tie them together. So do a double or triple band tie, because you want resistance, okay? So you'll come onto your backs. Lie down, take your feet hip distance apart, separate your feet, press out into the TheraBand, and you're gonna feel the outer hips engage. Here we're gonna hold for 30 seconds. If you can do this longer than 30 seconds, I recommend it. Usually we wanna go for a minute. And we're halfway through the 30-second mark already. If you want the minute-long version of this, go to my gluteal isometric series on YouTube and you can find that sequence drawn out more for you there. Okay, ready? We're gonna lift up into a bridge, hold here, tuck your pelvis under, keep your belly nice and tight, and you wanna keep pressing your knees out away from each other so that they line up with the hip bones in the front. So here you should feel the side hips really engaging and then also the glutes in the back. You want to stay here. We have another 10 seconds. If this hurts your back at all or hurts your knees, so if it hurts your back, you want to come down a little bit. If it hurts your knees, you're going to step your feet out a little bit more and work from there. Okay, now from here, we're going to pulse up. So you drop your hips down an inch and pulse up and up. So we're adding a little dynamic movement. The isometric is meant to facilitate a connection between your glutes and your brain. Just so your brain goes, oh yeah, now I know what you want me to focus on with these exercises. Now, it used to be, back in the day, people thought, oh, it was the quad causing a lot of the problems with the knee, and that's not true. You can have quad weakness, that is true. But it's not going to be the only reason why your kneecap isn't tracking well. It's usually because things are tight, they need to be released, and you're not using your glutes and the control room of your whole leg as well as you could be. Okay, come down, roll onto your side. You're going to do a clamshell position like this. If that hurts your knee, you'll take your leg straight, pick it up, and then kick it back slightly. I'm going to stay here. So you can say this one. This version is harder or more difficult than the clamshell version. Just be careful that you're not letting your leg drop like this. If you see that, you need to lift it back up. Or maybe you need to stay in that clamshell position and that's where you stay. But if your clamshell is here, you need to lift it there, okay? Keeping your belly tight. You can rest your head down here, you can be propped up, you can even be propped up here. That part doesn't matter so much. Okay, ready? We're going to the other side. The other thing I want want you to keep in mind is that your knees, your hips, and your shoulders are all in a straight line. Your knees are not forward here. You're not doing a clamshell from here. You're keeping everything in alignment this way, or you'll take your top leg, straighten it out, lift it up, kick it back. And we're holding. Belly is nice and tight, shoulders down. So if you're resting on your shoulder like this, I want you to push. So you're not collapsing in this area. Everything is staying in great alignment, okay? Or as good as you can make it. It does not have to be perfect, okay? It just needs to be with a good level of effort. All right, ready? Now we stand up. Take your feet hip distance apart. Press your legs away from each other slightly, and then you're going to come into a little bit of a squat. Now, we're doing a glute-focused squat, and it's an isometric squat, so you're sitting your butt back. We're not doing this one, okay? Doesn't mean that that is not a good squat. It's not what we want right now, okay? So sit your butt back, press your knees out, and we're holding. Keep your belly nice and tight. Now, I'm going to give you this view. If you find that your knees are caving in like this is exactly the control we're trying to regain. Push it out. So keep your gaze down and make sure your knees stay over your ankles and stay in line with your toes and they don't cave in. This is not good. We want it parallel, okay? And then from here, we're going to do little pulses. Little pulse down, down, down. Keep going. Now, do you have to have your hands in a prayer position like I do? No. You can have them here. You can have them here. You can do anything you want. You can have them on your waist. You can be sassy. Ready? And then stand up. Now, stand just on your right leg. Take your left leg up. Take it back. So we're kind of kicking this out to the side. We get this glute to activate and also your standing leg. Your standing leg should be working the most here. And you really want to lift up out of this hip, squeezing your glutes. This becomes a balance exercise too. If you have a hard time doing this and keeping your balance, you'll be next to a wall and just put your finger against the wall. Or you can lose your balance like I did and just correct it. By the way, it's okay if you lose your balance. This would be called balance training, and it means that it's something you need to work on, and that's okay. Ready? We're going to switch sides. Transfer your weight onto your left leg, squeeze your left glute, take your right leg out to the side, kick your right leg back a little bit, and we're holding. Now, if you notice my knee's a little bent, and it's bent with my knee pointing over my toes, in alignment with my toes, I'm not letting it cave in. And this glute is working a lot more than this one. Keep your belly tight, keep your breath even. Good, ready? We go back to the other side. Now we're gonna do little pulses here, little pulses down. Make sure your knee is in line with your ankle and your toes. Keep pulsing. Now your butt should be burning quite a bit. Good, couple more. Ready, switch legs. Go back to the left side. Right leg comes out and we're pulsing. Little pulses. You should feel it in your glute. If you don't, put your hands on your glutes and make them work underneath your fingertips. Yes. Great job. Okay, now, last part to this. We're gonna come into a full squat and then back up. When you come down into that full squat, we're only going as far as it feels good on your knees. So if it hurts to come this low, don't come this low. Come down to where it's like, I feel good to there. Okay, great. What I don't want is this. That's what we're trying to correct. You can see how, oh, that's why my knee hurts, right? What happens when we're running or going upstairs is we're not noticing it, but you have one leg that goes boonk like that. And that rubs the bone against bone, and that's what causes all that inflammation and pain. So we're going down and up. When you come up, you're squeezing your glutes at the top. I'll give you side view. You're sitting back, coming up. Keep going. And look down, make sure, oh, is my alignment good? You'll notice the TheraBand helps you press your knees in the right position. Good. One more. Fantastic. Okay, now, if you need a wall, use a wall. If you want a chair here, you can put a chair in here. If you can do this without, great. Stand just on your right leg again, and you'll come into a single leg squat, come back up. Ah, see how that knee wants to go and misbehave? You have to watch yourself. So this is a great one to do in front of the mirror. Good, keep going. This is 4, 5. Notice how slow I'm going. I'm searching for the control. 6, 7. Your butt should still be burning here. 8. You're gonna feel your quads now, and that's okay. 9. Last one. 10. Great. Last side. Single leg squat. So when we run and we land on our leg, it's a lot like a single leg squat. So before you go for a walk or hike or run, do this whole sequence. This would be great for you. Good, 5 more. 4, 3, 2, and 1. Good job, everybody. Take the TheraBand off. And that's it for this sequence. I hope you enjoyed and found value in this sequence. This is the second phase of what do I do when my knee hurts. Now you'll go and do whatever it is you're gonna do for the day. If you feel anything around your knee still, some pain, it's okay to ice it. Ice does help with pain and inflammation. And some people are like, well, maybe heat feels good. Okay, you can alternate between ice and heat. The heat's gonna bring blood flow to an area, and the ice is gonna help bring down swelling and inflammation. Okay, so I hope you enjoyed this. I hope it helps you with your knee, and I hope your knee feels better. There is a lot more material we can talk about with the knee, so look for follow-up episodes on our knee and about our knees. If you have any questions, you can email me, paula@alignptla.com. You can also leave a comment down below in the comment section. I love getting the comments and I love getting the requests. It's been really fun. And I look forward to seeing you all very soon. Once again, my name is Dr. Paula Sauer, and I'm with Align Physical Therapy. Bye, everybody.